Welcome to Rehab Reels, conversations on physical medicine and rehabilitation, hosted by Dr. Gwen Soa. My name is Andy Ziegler with UPMC and the University of Pittsburgh. I'd like to welcome everyone joining us today for a special presentation on recreational therapy. Our series host, Dr. Gwen Soa, is the endowed professor and chair of the Department of Physical Medicine and Rehabilitation at the University of Pittsburgh School of Medicine, and is the director of the UPMC Rehabilitation Institute. She holds joint appointments in the departments of orthopedic surgery and bioengineering, and has served as a clinician scientist in PM&R for over 15 years. Our featured guest is Jeff Bisdy, a therapeutic recreation specialist at the UPMC Rehabilitation Institute at Mercy. Jeff has over 20 years of experience developing therapeutic recreation programs and personalized activities for adults and children who have experienced stroke, brain injury, spinal cord injury, amputation, cerebral palsy, and other musculoskeletal and neurological conditions. Jeff has extensive experience working with people ranging from 18 months to 107 years old. He believes that people should do their best and have fun. Dr. Soa, the floor is yours.
Well, welcome to this session of Rehab Reels. We're so excited today to be talking about recreational therapy. You may have not heard much about this field, but as you'll hear, it's a super exciting and engaging field, and we hope that what you'll take from this is either ways to incorporate this into your practice if you're a clinician, or into your world if you're a patient looking for ways that this might be of benefit to you. So I'll turn it over to you, Jeff, and look forward very much to hearing about what you have to share with us today.
Well, thank you, Dr. Soa, for your invitation and this opportunity to share recreational therapy with the world. Thank you for those who are watching, and I hope you really gain a lot from my presentation today on recreational therapy. What is therapeutic recreation? American Therapeutic Recreation Association, ATRA, defines it as recreational therapy, also known as therapeutic recreation, is a systematic process that utilizes recreation and other activity-based interventions to address the assessed needs of individuals with illness and/or disabling conditions as a means to psychological and physical health, recovery, and well-being. Recreational therapy is not all fun and games. Recreational therapy is a treatment service designed to restore, remediate, rehabilitate a person's level of functioning and independence in life activities. The life activities that we all enjoy throughout our existence in this world. It could be just very passive activities up to very active kinds of things that we enjoy doing when we work to play. And the idea is really for recreational therapy to help patients get back into the things that they really enjoy in life. And also to promote health and wellness by participating in these activities and in a full, rich leisure lifestyle, your health and wellness will certainly improve. And also to eliminate the activity limitations and restrictions to participation in life situations caused by illness or disabling conditions. So that could be adapting activities, adapting sports, adapting recreation to help folks get back into doing activities, or to just practice these things while they're in rehab. So when they do go home, they are able to really enjoy their leisure lifestyle. The purpose behind recreational therapy is specifically targeted to each patient. And really learning how to live with a disability. So by specifically targeting to each patient, we're able to help that individual learn to live with their disability, especially if we're doing community experiences and also practicing those activities that they enjoy in life. But getting back out in the community and sharing or experiencing those kinds of activities that they are utilizing at the rehab in the community is going to help them learn to live with their new body in the community and at home. Enhancing quality of life. There is some studies done to show spinal cord injury that a year after rehabilitation, that they are, if they have engaged in recreational therapy during rehab, that their quality of life in it is enhanced. We're going to talk a little bit more about that in a couple bullets down. Also, reducing hospital isolation. It's really important when you're in a rehab. It is not acute care, so it's rehabilitation. And recreational therapy views rehabilitation as a means to get back into the community. So it's really important to start that process by getting out of your room and really enjoying the activities, participating in leisure activities, and facilitate that full participation in life as you're going through rehab, practicing what you need to have a full life once you leave. It's really important to do that, to get out of that room and participate, socialize, and be active. It's certainly going to help your rehabilitation process. Improving or maintaining physical, cognitive, social, emotional, and spiritual functioning. Those areas are really what recreational therapy is about. It's a very holistic way of helping a patient through rehab. Improving community participation, health and function, and recreational participation post-injury. Again, this is another study that was done showing that a year after rehabilitation, if they had participated in rec therapy during their rehab process, and that they were able to enjoy the community more, and they're healthier and are more functional at home and in the community. And also showing that rehospitalization goes down as well. And then last, improving functional outcomes. There's been studies done with traumatic brain injury and stroke. This is pending, but I overlooked that study, and it looks really wonderful for helping patients really improve their outcomes post rehab. Some of the recreational therapy activities that we may do here, or that is common among recreational therapy, are arts and crafts, horticulture, working with plants, music, interactive games, virtual reality, group outings or community reentry, adaptive sports, and adaptive recreation. So we're doing some of these things now, but not to the fullest extent. We do some with the art program, which you'll be seeing in a minute. We do crafts quite often. Sometimes we're doing some horticultural programs and some music activities. We're not really doing community outings, a little bit with our Gone Fishing program, which physical therapy started here. And the adaptive sports, not so much at this point, but I do work with some patients on introducing them to what's out there in the community for adaptive sports. And adaptive recreation, that could be anything from a passive thing, like as you can see, the card holder holding the deck of cards, to something more like gardening, using adapted tools for gardening. Or it could be, something where I might introduce to patients some resources in the community for adapted hunting, adapted fishing, snow skiing, and that sort of thing. At this point, we have a program called Experience Art. It's led by a volunteer, Jared Quinteros, who is a former spinal cord patient. He approached the Rehab Institute to come in to teach patients how to paint and create art. He's a local artist himself, and really is an asset to the spinal cord patients here. He comes in once a week. I set it up for him, facilitate the program with him, and get all the materials, and he just goes around from patient to patient as they come in to the Experience Art program, and he teaches them how to paint. And whether they have any experience or not, or if they are accomplished artists. Either way, he's going to help that person enjoy some art. We've had some patients who say they can't draw a stick figure, and they come out of this program with a really beautiful painting. As you can see behind me, there's some pictures of some just copies of some of the artwork that patients have done. We're going to take a look at a video that is about Jared. It's a really striking and wonderful video of Jared and his story. So let's take a look at that.
2 years ago, it was June 17th, 2021. My wife and I went on a hike. Halfway through the hike, we had a giant tree limb fall on us out of nowhere. It hit me in the back, broke my back. It hit my wife in her head. And so we were brought here to Mercy, both of us. And I ended up going into surgery. She ended up later dying from her injuries. All my life, I grew up doing art. I'm self-taught. So after my injury, after my accident, thinking of the things that I still can do, art was the one thing that I'm like, I gotta just get back into painting. I am a volunteer at UPMC, and I am working with the staff here to create an art therapy program. Having had been a patient myself and experiencing the first time someone in a wheelchair had rolled into my room and talked to me, and I could see, that there is life after a spinal cord injury, it was really motivating, and I wanted to give that back and give that experience to other people. But I mean, that's why it's important, that story, and sharing it with other patients that are going through this experience and they're feeling down on themselves, and then I come in and talk to them and kind of show them that what I went through was pretty bad, and I'm okay, so you can be too. And so giving this to people helps them mentally, so the mental health portion of it is the component that I'm trying to add to the rehabilitation. It's inspired me to keep moving forward and to do more, and it's inspired them to find that spark for what's afterwards.
So that video really demonstrates where recreational therapy can be effective with a patient by bringing in folks like Jared to help be a role model, but and experience a different kind of activity. And that's something that I want to achieve here, is to experience art, experience music, experience sports, recreation, and so on. And that's what we're after. There's additional therapeutic recreation interventions that I'm working on at this point that we are going to be getting on the brain injury unit, and that is a multi-sensory environment. This is something that I've worked with patients and clients with over the years that really has helped with patients who may be coming out of a coma and they need more stimulation to help them participate better in rehabilitation. So this room is a dedicated room with multisensory tools such as video and calming kinds of video, bubble columns, fiber optics, tactile walls, aromatherapy, calming music. And this room is really designed for that patient to explore on their own without any threat in terms of getting injury or anything like that. It's a very calming place to go to. But it's also for those patients that maybe they need relief from some pain. The doctors and the therapists work with patients on relieving pain, but sometimes they need to be distracted from that pain as well. So going into a room like this can really help distract them from what they're feeling in terms of pain. and get into some really calming kinds of activity that will distract them from that pain. It's also good for those patients on the brain injury unit that might be in an agitated state, and they need a distraction from what's agitating them, in a sense, and helping them to concentrate and focus a little bit more. So this room could also help them go in, when they go into this room, they're going to really be distracted from what is occurring, and to make them agitated and calm them down, and really help relax. So I want to thank you and Dr. Soa again for this opportunity, and turn it back over to you.
Well, thank you, Jeff, so much. It was great to kind of hear a tour of what's been going on and the great work that you're doing. I think, hearing the impact that this work has had on our partner Jared as well is great. It's great to see that, and with all these amazing benefits, it really can be fun as well, and still have all these great benefits. So, I wonder what do you see in the future for rec therapy at UPMC at the Rehab Institute?
Yeah, that's a great question. I was hired here a couple years ago, about 2 years ago, and with the anticipation that I could develop a program here. And when I was told that I had that opportunity to create a therapeutic recreation program, that really jazzed me. I really liked that opportunity. So what I would like to see for the Rehabilitation Institute, and especially the patients and the family, and the staff as well, because everyone's going to benefit from a full therapeutic rec program, is to really have enough therapists to work on the units effectively with patients, and to move away from what we have now, which is an activity model, move from that to a therapeutic recreation model. And under that model, we would be the therapeutic recreation. I know the terms go back and forth: recreational therapy, therapeutic recreation. The way I look at it is therapeutic recreation is the umbrella. And under that umbrella are various kinds of modalities like community reentry or adapted sports, adapted recreation, horticultural therapy, music, art therapy. And then there's recreational therapy, which is under that umbrella to help a patient more one-on-one, working with that patient to help them get back into a quality leisure lifestyle again, by meeting with the patient, doing assessments, doing treatment plans, and really being a part of and an equal part of the rehabilitation team during their stay here.
Mm-hmm.
So that's what I'm really shooting for, and building off of the successes that we have now, which is the Experience Art program and the multi-sensory environment.
Yeah, so full integration with the team at all through the continuum of recovery, it sounds like, is what you're thinking. In addition, not focused on just the inpatient time, but also through the whole course of recovery, right?
Yeah, and that would also, when I say it would also benefit staff too, we would also do co-treatment with therapists.
Mm-hmm.
So, by introducing some of the recreational therapy activities with the other physical therapists, OTs, PTs, speech therapists, it's going to, really make their day a little bit different too. But also that collaboration, I think, is going to be really great to, work on leisure activities, recreational activities, with really functional goals in mind. So.
Yeah, so that raises another question. You allude to what people think of as the kind of traditional therapy, right, with physical therapy and occupational therapy or speech language pathology, but incorporating this into that therapy, people will probably have the question: is this something that's covered, or would there be an out-of-pocket cost, or does insurance pay for this sort of thing?
Yes, and right now, and historically, recreational therapy is not paid for by insurance, which is something that the CARF, the Commission Accreditation of Rehabilitation Facilities, is working on. they're actually introducing a bill now to add recreational therapy in the 3-hour rule in the rehab day. So right now, as you know, rehab patients, to be in rehab, you have to be able to do 3 hours of therapy every day. So what CARF is saying is that they would like us to be part of that 3-hour rule. And then that would kind of make insurance companies have to pay for recreational therapy. And so we would end up billing for that service, which would be wonderful.
Yeah, yeah. So right now in our programs, there's no cost for the patients to participate in things, right? So,
Correct. There's no cost for the patient whatsoever.
yeah. You mentioned as a therapist right now, not a lot going on in the adaptive sports space, but certainly Pittsburgh is a hub, is very rich in clubs and organizations for adaptive sports. And I think, people might not have awareness about how they can get back in a boat and row or play ice hockey or some of the other activities. So can you talk a little bit about what you see as the future for adaptive sports in this space?
Oh, absolutely. Yeah, right. Currently, I'm working on the spinal cord injury unit and the brain injury unit. So they have, approximately 18 to 20 patients per unit. And that's a lot for me to get to know patients one-to-one. But when I do come across someone that might have, that I could, say, that there are organizations out there for you, then I do that. There are, a multitude of organizations, really wonderful groups here that focus on, snow skiing and water sports and hunting and fishing and all sorts of things. So when I do come across a patient, I will bring that up to them. I also have a board where they can focus on the QR code and they can find out information about these organizations too. But sometimes I think it really takes that one-on-one to really motivate a patient, to inspire them to get out there. So that's
Find that community and find maybe even a mentor within that community that can be helpful to them as well, right?
like Jared is a good mentor that way, and he's
Absolutely.
also very knowledgeable about what's out there in the community too.
Right. Yeah, and it can be helpful in helping people take that first step in something that might feel a little daunting.
Yes, right.
Yeah. I'd love to hear more about the multisensory environment. So you talked a little bit about the beneficial effects in pain, and certainly pain itself is an experience. And so modulating that experience with your other sensory input can have very, very real effects on not just your experience of pain, but the pain itself. And so what have you heard from patients so far about this environment, what they're seeing as benefits?
Yeah. Well, we don't have the multi-sensory environment set up here yet, but my experiences in the past, um, I've had patients who've had some pain, some chronic pain or episodal pain, where um, once they go into that room, because it's so set up to be calming, it really helps them start breathing again. Sometimes that breathing is a factor with pain, and so they can kind of just let that breath go and breathe and experience the room in a different way. And sometimes I've heard patients say that once they enter that room, everything else seems to disappear because it's just a different environment. There's no clinicians around, there's no hospital beds, there's nothing like that.
Yeah.
It's just a really inviting environment to go into.
Yeah. Well, it could be therapeutic in many ways, sounds like. So yeah, it's very exciting future work. And I think something we need to think about recreating in many of our clinical spaces.
Correct.
Yeah, absolutely. Tell me about, so for people that might be thinking even about getting into this field, whether that's volunteering or as a career path, tell me what does a typical day look like? What do you get to do?
Yeah. So right now, the way our program is happening is, as I said before, is more of an activity model. So I'm really focused on, providing activities. When I'm on the spinal cord unit, I try to do 1 to 2 activities per day that I'm up there. I'm on the spinal cord unit 2 days a week. So they're really getting therapy or recreational therapy activity 2 days out of the 7 days a week at this point. But that day that I'm getting those activities together, I'm really trying to prepare the activity for the patients, advertise the activities, and then facilitate those activities. So, and now we're also documenting on those patients who come to the activities. We document on, how they felt during the activity and what their function was during that time. And same with the brain injury, and it would be the same kind of day that way. Now, if we flash forward to the future, vision that I talked about earlier, that day would be a little bit different. We'd be seeing patients in a therapy session, so it could be a half an hour session or even a 15-minute session or an hour session, depending on that patient. Doing assessments, doing our treatment, focusing on the treatment plan, and doing therapeutic activities, maybe going out in the community, aquatic therapy perhaps. So it'd be a fuller day in terms of therapeutic intervention. Yeah.
Which is such an exciting opportunity for us and our patients, I think. So I share your enthusiasm about the future state. So this is great. I know we're nearing our end of our time today, but I hope that this has really stimulated some interest amongst our community for the power of some of this work and the impact this can have. I wonder if, as a parting gift, you might share with us maybe one of your favorite experiences to date in doing this important work.
Oh boy, there's many. There's been many activities, many therapeutic interventions or patients that I can think of. That goes back. I mean, I've been doing this for quite a while, but here at the Rehab Institute, I think the Experience Art program really has been that key to me that really helps me keep doing this kind of work, because I just see the difference with patients. We had a patient not too long ago that really never painted before, did anything like that. And he, an older gentleman as well, he's probably in his late 60s, early 70s, but he decided that he was going to start ordering some supplies and do this kind of work at home, and get tutored online with videos that he could find. So it was I think that was an inspiring moment too. There was another gentleman in the art Experience Art program that was quadriplegic from an accident, and he ended up using a mouth stick to paint. And over time, he really learned how to control that mouth stick with the brush on the end. And that was just an amazing thing to see, the progress that he made, and also not just the progress with the painting that he did, but also progress with his own mental state and how he felt about himself.
Yeah.
That was really wonderful.
It's very important, very powerful. And even as people start to gain these skills, starting to then share them with others can be very therapeutic as well. I know that's been the case for Jared. He shared that with me, that this opportunity to share his art and help others find that has been very helpful to him and his journey as well. So.
Yeah, and I think with Jared and the Experience Art program, that is funded by a donor as well. And without those kinds of funds, we really would be dealing with very little materials.
Right.
And so that's really where recreational therapy has to really be supported by more philanthropy and foundation funding. That's how a lot of the top rehabs that have therapeutic recreation departments operate those departments. Can hire 5 to 15 staff to accomplish those kinds of things. So,
Right. Right.
That's really what's making the Experience Art program successful. Not only Jared's enthusiasm and his experience that he can share with the patients, but it does take that kind of funding to help a program grow.
Absolutely. Absolutely. And this is a great testament to that. And I think, what you shared today shows that there's such a wide variety of opportunities and areas to get involved with. That if you have a special interest in an area, there's lots of ways that you can give back and make sure that others get to have that experience as well. So I think it's great. Well, thank you so much, Jeff, for the wonderful work that you're doing, and for sharing your expertise and experience here with us today.
Thank you, Dr. Sala.
Thank you. I'll turn things back over to Andy.
Thank you, Dr. Soa, and thank you, Jeff, for such an informative presentation. For anyone who has a question about today's session, or if you would like to learn about ways to support the Department of Physical Medicine and Rehabilitation or the UPMC Rehabilitation Institute, please contact me at zieglerra@upmc.edu. Thanks again, Jeff and Dr. Soa, and to everyone who joined us today. Please be on the lookout for future sessions of Rehab Reels, and have a good day.